Hey, how's it going, folks? My name is Taj. I am a Medicare sales agent, advisor, and consultant. I've been in the Medicare realm since 2017, and today's video, I want to talk about Medicare. So I want to give two specific demographics some foundational knowledge just to get going and to help build on future content that they come across, whether it be from my channel or someone else's channel. So it's my understanding that a lot of people who want to become agents but don't know where to start, they just get overwhelmed with the abundance of Medicare and all the information involved with it. And for my seniors, I understand that essentially when you guys qualify for Medicare, you're given a Medicare and You handbook for whatever year you might be in, and that's about it. Not too much is said about Medicare, so I want to help create that level of understanding so both people or both demographics can meet halfway and have a better interaction. I understand that there's a lot of misinformation out there, and unfortunately some of it comes from our own government, which greatly confuses a lot of the seniors that I've talked to over my years and experience in the industry. But also television with advertisements, they just don't give the whole truth. So if I don't get to cover all of that misinformation and miseducation in this video, please stay tuned for my next video. And without further ado, let's get right into it. Thanks. What is Medicare? Simply spoken, Medicare is a federal insurance program. It is for individuals who are 65 years of age, and it's also for disabled individuals. So some of the two major disabilities that we see who qualify for Medicare before their age 65 are people with end-stage renal disease, also known as ESRD, and people who have ALS, which is also known as Lou Gehrig's disease. So two types of individuals that qualify for Medicare: 65 years of age and people with disabilities. Now, there's a third category. We're not going to get into it here. We'll go more in depth on one of my later videos, but also people who retire early and have already worked the 40 quarters required to receive Medicare can qualify for Medicare before 65. But that's a little more advanced, so we'll talk about that in one of my next videos. When can people qualify for Medicare? We briefly touched on that with the who qualifies for Medicare. As far as the when, generally speaking, 3 months out before a person turns 65, they would receive a Medicare card. That is, if they've worked the required 40 quarters and they get premium-free Medicare. Otherwise, they would have to make an arrangement with Medicare and determine what exactly their monthly premium is going to be for Medicare Part A if they're wanting Medicare and didn't work the required 40 quarters. So 3 months out from their 65th birthday, they can qualify for Medicare and also enroll into a secondary Medicare option. Now, why would anyone want Medicare? Well, the short answer is Medicare is a very cost-effective way for seniors to insure themselves. And I know what you're thinking. You're thinking, well, I have employer coverage and I'm still working. I don't want Medicare. Or I have a retiree plan. I've worked 20, 30, 40, however many years. I deserve this retiree coverage, and you may not have to pay much for your premium. So why not keep that over Medicare, right? Well, in my experience working with individuals, that is both over the phone and in the field, when we review their coverage that they're getting from their employer or their former employer, 9 times out of 10, they're paying a lot more for that retiree coverage or that employer coverage than they would for Medicare. First and foremost, there are very cost-effective options when you start looking into the secondary options, and we'll be covering that here in a bit. But there's also the additional benefits that you can get from Medicare that oftentimes people are just not getting with their employer coverage or their retiree coverage. So people, I get it. You've worked very long for this coverage. You feel entitled to it. You romanticize about it. But what if it's killing you? What if it's killing your pockets? And that's another topic I want to get into, is that people who are looking to become agents, a lot of these individuals that we work with and that we help, they're living on fixed incomes. What that means is they're retired, their earning potential has gone down or is just not existent at this point anymore. So with all those years that they put into working, they're now living off of that income. And that income is finite, right? So it can run out. And if they're paying more than they have to for their health expenses, then they're running through their savings a lot quicker, which is leaving a lesser amount of money for these people to live off of. So it's greatly important to not only review with them the coverage that they have to make sure that it's the best coverage for them, if that's what they're telling you, or to find an alternate solution for them that's going to give them the coverage that they need, but also keep their pockets in good health. Okay, so now we're getting into the parts and the components of Medicare. We're not going to go in depth here in this video. I will have separate, more organized videos specifically tailored to the different parts of Medicare, but I at least want to give you just a general overview of the parts and the components. So first up, as I alluded to earlier, is Original Medicare. Original Medicare is comprised of Medicare Part A, which is hospital insurance, and Medical Part B, which is medical insurance. With Part A and Part B together, they are Original Medicare, and they will cover 80% of your hospital and your medical needs. You are expected to come up with the remaining 20% that they will not cover. And that's another point of contention for some people who think just having A and Part B is going to suffice for them. Well, that's just not the case, because as you know, it's kind of obvious, right, that you're responsible for 20% of any amount. And I don't know if a lot of the people that I've encountered or worked with in the past are really thinking about that. Maybe they're thinking about a lower amount, like, oh, 20% of $10 or $50 or $100. But the reality of it is, hospitals are in business to make money. There's a charge for everything in the hospital, from the food you eat to your bed down to the toilet paper. All these things start to add up, and God forbid you have something detrimental happen to you. But if it does, to an individual that only has Original Medicare, you're looking at a very pretty penny, a very hefty amount. So it's important to not only just have Original Medicare, that's kind of like the gateway into some of these other topics we'll speak about, but it's also important to consider some secondary options to help further mitigate that 20% you would otherwise be susceptible to. With Hospital Part A, what you'll find covered is inpatient hospital care, skilled nursing facility, some home health care coverage, and with Part B, what you'll find is outpatient care, home health care, durable medical equipment, preventive services like vaccines, shots, things of that nature. Now, there's another component. We've already gone over the Part A. We've already gone over the Part B. There is also a Part C. And this Part C, you may already be familiar with. It's referred to as Medicare Advantage. With Medicare Advantage, there's a lot more covered than otherwise would be only having Part A and Part B. So you can think of it like a package deal. With Part C, you'll also have accommodations above and beyond what Original Medicare will cover for your hospital care, for your medical care. You'll also find additional benefits like your dental, your hearing, your vision coverage. And I know what you're thinking, what about that flex card? Well, with Medicare Advantage, and there's a common misconception that people can only get flex cards as a standalone benefit. That's not the case. All types of additional Medicare benefits will always come through these Part C Medicare Advantage plans, okay? So not just the flex card, your over-the-counter card, any type of wellness program like silver sneakers, What else is out there? Meals on Wheels used to be included in a lot of these Medicare Advantage plans. The point I'm trying to make is that any additional benefit you hear about, you see on your television, you see on YouTube, you see on TikTok, you see on Facebook, is always through a Medicare Advantage plan option. So if you're unsure as to whether your current plan, if you have a Medicare Advantage plan, offers any of these benefits, call up, consult with someone such as myself, a Medicare sales agent, a consultant, an advisor. We are the only ones who know how these plans work, what benefits are included, and can help you review these options. And I want to take a quick caveat to say, I know there's a lot of confusion. I speak to a lot of seniors, and one of the first questions they ask is, oh, do you work for Medicare? Because their understanding is that people who work for Medicare are the people who can help them enroll into plans and get benefits, and that's not the case. The people who work for Medicare, Social Security, their job is to help you get Medicare Part A and Part B, and for some individuals, even automatically enroll you into a plan that more often than not is not going to be in your best interest. So the truth of the matter is that people like me, sales agents, consultants, advisors, whether they're a captive agent or a broker, we're the ones who have all of the knowledge of what plans have what plan is going to be in your best interest. We're the ones who make the comparisons between what you have and what you're looking to acquire and do what's in your best interest. Simple as that. I just wanted to touch on that real quick because that's one of the big ones that people aren't too familiar with. And oftentimes, they hang up the phone. You don't work for Medicare? Oh, click. And I get it because and this part's for my people trying to become agents. Seniors oftentimes are taken advantage of. So there's a trust factor involved when trying to help them and work with them. And seniors, there's also a level of trust that you need to have with individuals who are trying to help you. Because how unfortunate would it be for you to hang up on someone just because they don't work for Medicare, even though Medicare, they can't help you with what you're looking to do, and now you're back in the same position that you started. So my advice to both sides, first to agents, take your time, thoroughly go over things, do everything that's in the best interest of your client, the senior, and my seniors, take the time to build that trust and rapport with the agent, hear them out, and if anything sounds off or fishy to you, don't just hang up the phone, because you could be hanging up on something that could greatly or drastically change your life. Hear them out, ask more questions, get more information, okay? Now, that brings us to another secondary Medicare option, which is Medicare supplement plans or Medigap plans. So Medicare supplemental plans, they're kind of similar to Medicare Advantage plans in the fact that they're offered by private companies, right? Like your Humanas, your Aetnas, United Healthcares, your WellCare, Cignas, Blue Cross Blue Shield, Devoted, the list goes on. With Medicare supplement plans though, one of the major drawbacks is that they don't offer any additional benefits, at least not included as part of the plan, right? So for each individual benefit you'd be looking for, such as dental, hearing, vision, prescription drug coverage, you would then have to pay separately for all of those things. And not only that, and I didn't touch on this with Medicare Advantage, but with most Medicare Advantage plans, they oftentimes have a $0 premium. With Medicare supplemental plans, they typically have a hefty premium, and the premium amount is predicated on the type of supplemental plan that you want to opt into, so the type of coverage you're looking for, but also your age and your health. When you first qualify for Medicare, you can enroll into a Medicare supplemental plan without having to undergo any underwriting, which is a huge benefit. So if you have something or you suspect you have something, you can get that coverage you're looking for right away. Now, if you first sign up with a Medicare Advantage plan and then you change your mind about it and you want to get into a Medicare supplemental plan, well, now you have to go through underwriting. And if it's been a while, you're older now, So expect to pay a higher, heftier premiums than you would have if you just enrolled into a Medicare supplemental plan right away, okay? So the last component that I want to talk to you guys about is Part D, prescription drug coverage. With Part D, all you'll find is help with your prescription drug costs, right? So for those of you who opt into a Medicare supplemental plan and you have to purchase a separate Part D plan, all that's going to do is help you get your prescription medications. And for those folks who are looking to enroll into a Medicare Advantage plan, well, that component is factored in to some of those Medicare Advantage plan options. Now, there are two different types of Medicare Advantage plans, which I won't get into here in this video. I want to give it its own video to go more in depth and really show you the comparisons between the two and what could best, work out for you. But just know that Part D included with most Medicare Advantage plans and having to be purchased separately with Medicare supplemental plans. So with all of that being said, we are now at the end of the video. I hope it was helpful for you. If it was helpful, please like, share, subscribe to this video. It helps me better assist you guys, and it also makes it easier for people who are looking for this information to find it. Thank you for watching, and I look forward to talking to you all next time. I'll see you next week. Take care.